there, and welcome to this installment of Parenting Plus. I'm your host, Isabel Garcia. This is the segment where we do a deep dive into topics impacting moms, dads, families, children of all shapes and sizes. We are joined today with our very special guest, Dr. Geoff Weinberg. Thank you so much for joining us today, Doctor.
Well, thanks for having me.
Of course. And so you are specialized in pediatrics as well as infectious disease as it applies to pediatrics and as it applies to vaccinations as well. So that's our topic of discussion today is childhood vaccinations and for those who are expecting. And so just starting off, if you can just give us a little bit of your background in this field, that would be great.
Yeah, thanks. Well, I started in pediatrics several decades ago. I've been here in Rochester at the University of Rochester Medical Center now, in the Department of Pediatrics for 30 years. I specialize in both vaccine research and in diseases of the respiratory tract and the gastrointestinal tract of children, and also in HIV medicine, immunology. So I've had a pretty close relationship with following vaccine recommendations and vaccine science for essentially all of my career. I was at other universities before I came to Rochester.
Excellent. And thank you so much for all of that insight there. And when it comes to, of course, we're in the fall of 2025. When it comes to the just standard recommendations for routine vaccines for kids, as we talked, I have my two kids, 7 and 5. And I think right now that a lot of parents are facing, moms, dads, everybody is just so much information out there and so many places to get all the information. So when it comes to resources and where people can seek trusted scientific information, where should people be looking for that?
It's a great question. I mean, I'm not only a vaccine scientist, but I'm a parent and a grandparent. So I've had personal as well as professional interest in this. And so I try and relate that to my patients as well and to families that I advise. And I think for a long time, the place, in fact, since about 1995, the place to go was the CDC, was the Advisory Committee on Immunization Practices, which had harmonized their recommendations with many of us in the professional societies, the Infectious Disease Society of America, the American Academy of Pediatrics, American College of OBGYN. And so we tried over the years to minimize the different sources by funneling it through one place. Unfortunately, that's become very difficult in the last year. This year, the CDC's Advisory Committee on Immunization Practices had all of their carefully vetted members fired and replaced with what I would consider less vetted members. So that makes my previous answer of go to the CDC website very complicated. So I can supply several websites of places where I think you could go, like the AAP.org, which is the American Academy of Pediatrics. There's a site called immunize.org, which has a lot of childhood immunization questions and answers that are suitable for parents. But I think in this day of overload and in confusing messages coming out from different government agencies and the CDC and the newspapers and social media, it's often best to go back to local and talk to your pediatrician or your family practice person or your obstetrician, because they know you the best. And it's kind of like politics. Politics is best handled sometimes locally with people who know you and who know your situation.
Yes, we certainly appreciate that here, for the local news. When it comes to, the going back to the information overload, I remember when I first became a parent and just was trying to keep up with even just the basics, securing, insurance and just getting PCP set up, a primary care physician, and making those connections. So many families I feel like are facing so many barriers to that just initially. And so when it comes to getting connected initially and understanding just the baseline of what does my child need, where can people start?
I think I think pediatricians, all of us, I will blame us in saying that perhaps in the last few years and since COVID, certainly during the first part of the COVID epidemic, we may not have been the best communicators. Social media has really changed things too, where you get some good information and maybe twice as much some bad information. And it's very difficult for parents to tell the difference sometimes. And if they're retweeted or reset up on social media, then the less good information gets expanded, unfortunately. So I think the best place is, again, for new parents, the hospitals, whether they're in our system at University of Rochester or URMC, or whether they're in Rochester Regional Health System. I think the hospitals will help guide you to good pediatricians and family practice people, and you start with them and with their guidance for immunization. Again, the AAP they've revised their immunization schedule, which looks very similar to the previous CDC schedule, because both of them used to be the same. But the importance of the AAP schedule now is it has the most scientific and what I think are the most trusty and scientific recommendations about things like influenza and COVID-19 vaccines, which the ACIP is starting to diverge from. I think I think AAP also has, there's healthychildren.org. I think they try and set out several things for parents for all sorts of parenting information, not just vaccines, which I'm most concerned with, but
there's
cloth
so many
versus
different
paper diapers, feeding,
so much, the materials,
of
the
everything.
clothes.
And so I think the key is to find trusty websites with good information. I think the Academy of Pediatrics does a good job of that. I think the College of OBGYN, the ACOG, ACOG, does a good job of that. I think immunize.org does a good job with vaccines.
Excellent.
I think it's difficult because in this day and age, anybody can get a .org or a .com website.
Sure.
And sometimes the websites are named to attract you, but they may not have valid information. This has been a problem with many sites, many political sites, sites about child rearing, about conception choices.
Yes.
And it is hard for parents to find out useful ones. That's why I think talking to a doctor or that you trust and have a relationship with is often a good move.
Absolutely. And you're touching on essentially having some type of media literacy, I think, which I think kind of goes in with the mental health component, when it comes to just managing all of the information that's out there that parents are getting pushed to them, but also trying to navigate the best that they can as well.
I think it's very difficult, and the media. I'm not going to bash the media, but oftentimes in an attempt to be equal, the media has interviewed all different sides of an issue, which some of us think are already set. I mean, you don't go around interviewing people as to whether the world is flat or round, because the world is round, and sometimes. I think with vaccine information, with medical information, there's a little bit of a tendency to interview so many sides that parents and people in the community naturally get confused.
Sure.
And that's where you have to sort it out.
Absolutely. And so we appreciate you coming in here and providing some of that really honed local expertise. And you mentioned as well some of the variations that we're now seeing from the recommendations between the CDC as well as AAP. And so when it comes to just those nuances with the standardized, routine vaccine schedules, is my kid on track? The flu obviously season is coming up, if it's not here already. And when it comes to just the measles, mumps, rubella, just the standard vaccines, what should parents be expecting or questions that they can ask their pediatrician?
I think honestly, the first message is there's really no new evidence that should have led ACIP, the new ACIP committee, argue hasn't been using the standard expert advised protocols that were very carefully honed over the last 20 or 30 years to make recommendations. There's nothing really new about MMRV, flu, or COVID. So the recommendations that the CDC was giving last season are really the same as I would give this season. And that is, there are three big parts of it. One, influenza vaccine is good for everybody. Yes, it's true, influenza vaccine isn't the strongest vaccine. There are biologic reasons for that. There are biologic reasons that the flu virus changes all the time, and it's hard to keep track of it. But the vaccines are generally at least 50% effective in preventing illness in children and illness and hospitalizations, particularly in young children, and in pregnant women, and they're safe. And so what that means, 50% efficacy, it doesn't mean that 50% of the time it works. It means on an average, there's going to be 50% less illness in a vaccinated population. And so that's a good thing. If you can cut your risk in half of getting disease or going to the hospital, most people would, hearing it that way, would say, yeah, that's a good deal.
Sure. Making the information more easy to digest and understand.
The second thing would be the COVID-19 vaccines, which it seems like the federal government through ACIP has ratcheted down. Many of us in the Academy and the Infectious Disease Society of America, the Pediatric Infectious Disease Society, I'm a member of all three, just to as a disclosure.
Yes.
Many of us think that there shouldn't have been a change. There's no real evidence that the vaccines are any worse in pregnancy. And in fact, COVID-19 is still around. It's more common in the population, but the rates go up and down. We think it's going to become a sort of a regular virus like influenza is. But again, especially when we talk about children, which is my biggest area of expertise, young children have a higher risk of coming into the hospital with COVID-19 than a lot of older people do. And so we really should be immunizing children over 6 months of age with influenza and with COVID-19 vaccines to prevent them from being sick and, or worse, coming into the hospital. And the third vaccine you mentioned, where there's been some differences with the current ACIP, is that the MMRV vaccine, or the two choices, MMR separately and varicella separately, that has been an option for like 20 years. And we've been telling parents, in fact, most parents and most doctors give the vaccine separately at 12 to 15 months of age. About 75% of us, at least in this country, the data show that most people are already getting them separately. And then, but giving parents the choice, if you want to have it in one shot rather than two shots, we can do that. Then when the kids need their booster at 4 to 6 years of age, we often give it as one shot because the risks of any problems with fever are lower. It's just the booster. It's not the primary vaccine. And then the child's older and they may only wish one shot rather than two shots as opposed to a 12-month-old. So, and this information has been given to parents by pediatricians using the legally mandated CDC vaccine information sheets that say all of this.
And through various administrations and over
through all
years.
the administrations over years, and not to mention the WHO for other countries. So we were all a little confused that this issue came up again. There were no new data presented. There was just a rehash of data from 20 years ago, which we have been telling parents, yes, there's a small risk of, there's a tiny risk of febrile seizures if you give the combined vaccine at 12 to 15 months rather than one in one arm, one in the other arm. And yet, it doesn't give children epilepsy, it doesn't give them autistic spectrum disorder, it doesn't give them anything. And actually, febrile seizures sometimes happen with all fevers in kids. And this is just one of if you get a high fever, you can have a seizure. And so there's a tiny risk that's not been argued over. That's why we said, in the grand scheme of things, it's better to give 2 shots than 1 for that first immunization at 12 to 15 months. But if there are parent circumstances or child circumstances or doctor circumstances where you want to give it as 1 shot, the likelihood is it's going to be fine.
Okay. And
So we're a little head scratching as to why some of these issues are coming up, and we're worried that they're not science based, they're
Okay.
more opinion based.
And when it comes to parents, with all of the questions that are, you mentioned the various reasons why parents might be either one, want that choice, or two, be questioning. There are actual risks involved. And so when navigating those questions and that information, just to validate that there are those concerns out there, and there is, even if it's minute, a small risk. And so just that having that information, I think is super helpful for the parent and caregiver.
And I believe that most, I would want to say, I'm in the medical center, so I'm not constantly immunizing people in private practice, but I believe most of our local private pediatricians and family practice people have been discussing this with parents for decades.
Okay.
And it's in the vaccine information sheet that you remember seeing when they give you a shot. You get a sheet that has it's a CDC
the chart
sheet. That in fact one of our former faculty who used to work with CDC was engaged in making those sheets and getting that program started with so that parents would get good information in writing, and they're translated into many languages, into Spanish and other languages, so that all segments of the community are allowed to, are able to get that
access to information.
And I think the other thing that's important to remember whenever we talk about vaccines is the risk for all the vaccines that are on the market, the risk of getting hurt by the infection the vaccines are preventing against is way higher than you get with any of the vaccines. And that is consistently true for every vaccine we have on the market.
And we're seeing down south some of the increased rates of measles. And so I was going to ask about
deaths in California and Texas. There's lots of measles cases going on in Ontario right now, which is very close to New York, and we've been worried about it. Fortunately, it hasn't seemed to come down across the bridges.
Yes. But it is happening more
it is
frequently.
And it tends to be, the trouble is most vaccine preventable illnesses still exist in nature. Smallpox was the only one we were able to get rid of, and we got rid of it by vaccination. We've gotten rid of smallpox from the planet. And there's a veterinary disease called rinderpest, which has also been eliminated. It was a disease of cattle that really hurt farming efforts, particularly in lower to middle income countries. But other than those, we haven't been able to eliminate anything else. So these infections are out there, and some will never be eliminated. Some things like tetanus is in the ground, and unless you concrete the entire planet, you're always going to have tetanus spores around.
Right. Not necessarily most environmentally.
No, and that wouldn't be the nicest planet to live on if it was all concrete. So we have sort of a victim of our own success mentality sometimes in immunization, in that we have prevented so many of these conditions that our grandparents feared, and then we as children may or may not remember getting them. And then, I as an older child than you got a lot of these conditions, survived thankfully.
Yes.
But my kids have never seen anybody with measles, and my grandkids haven't. And so parents start to think, well, these conditions aren't around. Why should I immunize? And the problem is, as they're finding in Texas and Ontario and California and other places, is that the diseases are around. The reason you're not seeing them is because vaccines are so successful at keeping them at bay. But if we quit immunizing, then they're going to come back. And this has been shown in many countries, in many situations. In Japan, where they stopped immunizing against pertussis, they had major pertussis outbreaks. And then they started re-immunizing, and then they went down. This happened in Europe. And I'm afraid we're about to discover that here if people stop immunizing. That was children will get in trouble.
Yeah, that was going to be my next question. As we approach the fall and winter months, now that my kids are a little bit older, I am very much so wiser to start everything. I said I'm going to be the first in line for the flu vaccine this time, because I unfortunately came down with actually double pneumonia last year. So yes,
Yeah.
it was really tough. But when you're in that moment and you're obviously we're talking about kids, but seeing your child, in that state, or being that sick, really puts the limelight on the issue at hand. And so that was going to be my question too, was just the risk that's out there with, knowing that COVID isn't necessarily a seasonal thing as of yet that we're seeing, but what are the rates like right now when it comes to just trajectory and what our community is
I think
seeing?
it's still a relatively new virus, 5 years of age. And I think deep down, I think someday it will get less important, but I think it's still a moving target. I think there's some certain genetic reasons for the type of virus it is. But for example, the other coronaviruses, the other seasonal viruses, have probably been with humans for thousands of years. And so we've sort of co-evolved, and their common cold is less serious. But so I think the rates, I don't have the rates at the tip of my tongue today, but the rates are going up, and the vaccines are safe. So the best we have changed the vaccines for this year. There's a 25-26 strain that is genetically more related to what's out there in the environment, and that's why the suggestion is to get a booster, even though you've been immunized a bunch in the past, if you have.
Yes.
And the same with influenzas. It changes a little bit each year, and so we suggest new boosters. For kids under 9 for influenza, if it's their first time getting them, get 2 doses. If they've had a dose in their life before, you only get 1 dose. But I think the problem is, again, the vaccines are not going to be perfect. There are going to be some people who get the infection anyway. But they're better. It's a risk management issue. It's, if you drive without a seatbelt, you might do fine until you don't. And then you'll say, gee, I wish I used my seatbelt before I got thrown out of this car. Or bike helmets, or motorcycle helmets. There are just so many things in society and in life that we can't totally control, but when there's a safe and effective option, it makes sense to use it. It's just another thing in your toolkit. That's absolutely right.
And one thing I wanted to touch on as well was just we were starting to talk a little bit about access. And we have about 5 minutes left in the segment, but just in terms of, we're starting to see that there's pediatrician offices locally that are not having stock yet of the COVID vaccine for children under 12. Is there any indication, when that might be available, or what's the risk there?
I'm hoping it will be available soon. I don't know in Monroe County or in the surrounding counties yet what the situation is. I think this is something for the public to think about with the new administration. The problem with, it's one thing to say ACIP has now opinion-based and the people on it aren't very expert, and we can look at the American Academy of Pediatrics schedule, for example, and trust it. That's easy for me to say, and I believe that. The problem is, by law, the insurance companies and to some extent pharmacies will only reimburse vaccines that are on the ACIP schedule in the Vaccines for Children program. They can reimburse them with private insurance, but private insurance must follow Vaccine for Children's program, and then they have choices as to other things. So the danger of, somebody might say, who cares who gets appointed to ACIP if you tell me you as a doctor will give me my best advice. That is true, but it's difficult for me. I can't pay for all my patients. And so I think we really have to be careful when these changes come down to the CDC. They have ramifications that I think sometimes the people in charge don't realize. In fact, ACIP, the current members didn't even understand the Vaccine for Program Children because the Vaccines for Children program, VFC, because last Thursday they voted one way, and then Friday they overruled themselves and had to and voted again. it's clear that they don't really understand all the ramifications of the job they think they're going to do. How that translates to us locally, well, I hope that pediatricians can order these vaccines anyway, but vaccines are expensive. Part of the reason for the Vaccine for Children's program was to provide coverage for all segments of the population.
Okay.
I think we run a risk in this country in the next few years. If coverage goes down, you'll find well-off people getting one brand of medical care for their family, and people who have trouble affording vaccines getting a different brand of medical care. And that's not at all what any of us want or desire. And so all I can say is I hope the pediatricians get more availability of vaccines.
Okay.
I think in New York State, the Commissioner of Health and the governor have already sent out standing orders that pharmacies can use. So the Wegmans, the CVS's, all the different pharmacy chains in this state are being told they can continue to immunize without without you showing up with a prescription. That's going to help quite a bit. Not all states are getting that. So it's going to become a little patchworky over the United States, which is not what any of us think should be done.
Well, I really appreciate all of your expertise and your insight on all of this. And I think the ultimate message, and correct me if I'm wrong, is just going back to pediatrician, just going back to your local trusted doctor.
Support your vaccines. They really are the best thing since sliced bread.
Well, thank you so much, Doctor, and thank you for joining us for this installment of Parenting Plus.
Get the Rochester First streaming app today for everything you love from News 8 On Demand, plus exclusive shows you won't see anywhere else. Search ROC and download for free on Roku, Amazon Fire, and Apple TV.